Hey guys, Dr. Steve Fort, just driving from ACE Physical Therapy Clinic, our Dallas clinic, back home after being at the Dallas clinic, our satellite location for the day. I had a I had a really interesting case study that I wanted to share, or like a patient. So I have this patient. He is in his 50s. He's in his 50s, and he was experiencing some neck pain and some unusual symptoms. So this was his history. He told me, all right, so I have this morning routine that's takes me about 30 or 40 minutes to do, and I don't do it every day, but on the days I do my morning routine, I will have kind of like some dizzy, some nausea, some like fogginess, like just don't feel right in the head. Sometimes some like migraine symptoms, like a little bit of pain and stuff like that in the back of the neck, like upper neck, suboccipital area. And I was like, well, I can understand how you could have like pain and stiffness and tightness there, but some of these other symptoms you're describing, they're a little bit interesting. Yes, you can have cervicogenic dizziness, you can have cervicogenic ringing in the ears, you can have orbital pain coming from the upper neck, like the alar ligaments, and a variety of things that can happen with like a upper cervical dysfunction, but they didn't match all of his symptoms. In fact, his symptoms to me were more fitting like something else. So I told him, okay, so on the days you do your routine, you have problems. On the days you don't do your routine, you don't have problems, correct? He said, correct. I said, well, okay, we clearly have a mechanical issue here. So tell me more about this routine, and what do you think in the routine is your problem? And he told me, well, he has a beard, and he says, as you can see, I have some white hairs in my beard, and I like to color my beard. So occasionally I'll color my beard, and that's, besides like skincare and stuff like that, I have to color my beard. And so I'll sit in front of the mirror and I'll have my head in this position for a while, in this position for a while, in this position for a while. And I said, okay, what you just showed me, your head being turned and cocked back, what you just showed me is a test that I do in the clinic for vertebral artery. In fact, we used to turn the head all the way and cock it back. And then I think some research came out of Australia that said you're really kinking the vertebral artery a lot, and that much movement is not necessary. We can test vertebral artery with just a rotation alone, count down from 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And if the patient experiences any of the 5 Ds or 3 Ns, that test is positive. And we say something's going on with vertebral artery. So if we turn the head in that position for 10 seconds and the patient reports dizziness, double vision or diplopia, dysphagia, difficulty speaking, dysphagia, difficulty swallowing, or if they have a drop attack, which is like they faint or like a syncope, which are the 5 Ds. The 3 Ns are numbness in like the lips and tongue, nystagmus where the eyes are bouncing, or nausea. Then that test is considered to be positive, and we might refer the patient out to get that checked out. So that test position, he was sustaining that for like minutes and minutes and minutes and minutes. And so I think anybody that sustained that position for long enough could potentially get those kind of symptoms. And the only reason I treated him and I didn't refer him out is because this thing had a mechanism of injury, right? When he had his morning routine, it would cause problems. So I told him, I think you are straining your neck. I think you're shutting off a little bit of the flow to your vertebral artery, and that can give you these kind of symptoms. I don't know why they're lasting that long. I wouldn't expect them to, but they can give you these kind of symptoms. So here's what we're gonna do, right? This is the hypothesis, and he's seen doctors and neurologists and stuff like that. So he's under like supervised medical care, In fact, I think he'd had like an MRI and some imaging and stuff like that already. So he's been medically screened to a large extent, okay? So I kept him as my patient. I didn't refer him out. And I said, here's what I want you to do. I believe this is because of this position being sustained for a long time. So here's what you're gonna do. You can do your morning routine, but you need to modify your setup. So you have mirrors, several mirrors that you can look at and do what you need to do while keeping your head in a pretty forward-facing, like neutral position. You can turn a little bit here and there, sure, yeah, but let's not be sustaining that or that for a really long time. So he said, okay. So I saw him like 2 days later, and he said, yeah, I have made those adjustments and I haven't had any symptoms. I saw him a week later, and he still hasn't had any of those symptoms. So I think I have like one more, maybe 2-week follow-up with this guy. We'll see what happens, but I'm very optimistic that we found the problem, and it's such a great case study. On my first session, we did do that counseling and education. I also did mobilize his cervical spine. We did some stretches, some suboccipital release, mobilized the scalenes, did some decompression. Just wanted to set the neck right. I don't remember if we did dry needling or not, but we could have, right? So, but yeah, so long story short, we've cleared his neck of anything musculoskeletal at this point. There's no more joint dysfunctions. There's no more hypertonic scalenes. So yeah, anyways, just a very interesting case study, vertebral artery case study. So yeah, something to look for in your own clinical practice. Enjoy. Thanks.